Good morning, everyone. Thank you for joining me today. I'm Aruna Devi, a psychologist at Buddhi Clinic, Chennai. Over the past few years, I worked closely with patients facing a range of neurological and psychiatric conditions. And just importantly, I've worked with the caregivers along with the patients. Today's talk is titled Empowering Those Who Care, Prioritizing Caregiver Psychological Health. Uh, when I say caregiver, who exactly is a caregiver? Uh, when I first started in this field, I used to think maybe caregiver must be a person who just accompanies the patient for treatment. Over a few years, I've realized that a caregiver can be a spouse, a child, or a parent, or a friend, or even a professional caretaker. Maybe they might not wear uniforms and scripts, but the emotional load they carry often goes unnoticed. And when they get overwhelmed, that stress plays a significant role in patients' recovery journey. I've seen caregivers sacrificing sleep, their career, even their own health, all out of love. And despite all of this, they're often invisible in the system. So, here I just want to prioritize them today and talk about their emotional distress, burnout, and what actually they undergo. And there are some strategies and some therapy sessions which can actually help them. And I am here to also discuss about Buddhi Clinic, which offers an integrated care model that not just only for the patients but also for the caregivers. So, emotional landscape of caregiving. So, when a person comes in, I notice the caregiver has a lot of emotional distress, not just they are tired. Beyond exhaustion, they also have a lot of complex emotions with them. Maybe they might not realize, or they might realize, and they might mm, face challenges in processing all of those emotions or terming the emotions. I've noticed people with increased guilt, fear, anxiety, maybe anxious about future or questions and guilt on themselves that despite doing all of this, are they doing enough to the actual patient, and they might blame themselves or have a critical perspective about themselves. I think they caregive more than patients prioritizing caregivers mental health is very important, and focusing on the underlying stress, burnout, and enhancing their mental health plays a significant role in the journey. So the very important signs to watch in a caregiver, it's not just physical exhaustion and mental tiredness. It's more than that. It's emotionally, people might feel irritable or constantly sad, plain helplessness, mixture of emotions. And cognitively, I've seen people forgetting appointments, missing things, struggling to focus just because of their stress and unnoticed emotional burden on themselves. Physical indicators to watch are chronic fatigue and loss of energy levels, disturbed sleep patterns. Maybe they might care for the patients during the night hours, and so they are trying to sacrifice sleep but missing to notice that their biological clock inside is getting affected, and so their health is going into a negative loop. People might have frequent headaches or body aches, which generally people think it's just the tiredness. If I get a good rest. If I rest myself well, I'll start feeling better. But actually, the body aches or headaches might be a sign that they might need some rest and gap. Or some that might also impact their immune system. So, having a watch and monitoring that is also very important. And the behavioral indicators on a person who's actually caring for a patient or someone who is ill in the family, behaviorally, the caregivers might withdraw themselves. They might think their social battery is down, so they are exhausted to just spend time with other people. But that might be also a reflection of their distress. And at times, people might consume more alcohol or other substance. At times, people might lash out at others. But few caregivers have thought that this is my usual personality, but just I want to emphasize that when you start noticing more than personality, the distress might increase the intensity of their anger or irritability, and so their normal functioning and behavioral uh, usual behavioral patterns might vary and go into a negative loop. So prioritizing that and focusing on the behavioral patterns, and if there is a change, just picking on that is very important. And also at times we might miss our self-care routine or personal hygiene, just focusing on the person who is ill in the family. I understand it's very important to focus on the patients or the person who requires help in the family, but at the same time prioritizing our own health and taking care of ourselves is very important to support the family member in a long term. I just wanted to people remind people here that please take care of, monitor your behavioral patterns, physiological cycle, cognitive functioning, and emotional regulation as well. And when I say this word burnout, at times people might think it's just the word, but actually, I want to emphasize that burnout is real. It actually refers to emotional exhaustion, depersonalization, and a sense of reduced accomplishment. And yes, caregivers can experience all of it. It often looks like emotional exhaustion. You might start feeling nothing is there for me to look up to, or people might feel numb at times, like go into an autopilot mode, or say do monotonous activities, just follow the routine for a week or that without even recognizing the need for themselves to bring in another activity into their routine or add a new activity which can make them feel better. They just start focusing on the other person in the family and completely miss out on their self, so their own peace or their own satisfaction and calmness and a sense of relief just goes into a blind spot. At times people might feel that they are actually failing or they are actually not performing or giving enough to the family member who is actually ill. But when we look back and start digging deeper and make people understand that they are supposed to take care of themselves and notice on their uh, achievements or their work which is playing a significant role in improving the patient's progress and improvements. It's normal to struggle. So, I say this a lot in therapy. It's okay to feel overwhelmed. You're not a robot or a machine. But you know what? Caregivers often hold themselves. So you know what? Caregivers often hold themselves to impossible standards. They have an expectation. I understand the expectation which they hold is just to focus and help the family member who is ill and to improve them. But that is actually when we go back and check on their expectations, at times the expectations might be realistic. Most often, they might set the standards higher, and unrealistic expectations also cause them to push through pain, grief, or everything because They think giving more will help them, giving more will help them, but without understanding that giving more might deplete the energy which you are actually having. Again, I wanted to remind people here that it's normal to struggle. Struggling doesn't mean that you're not coping, it just means you're human, you're not a machine or robot. Even trained professional like me have felt helpless in caregiving roles. I've seeked therapies or I've seeked guidances just to maintain when my family member was ill, to maintain myself, and so I can give a lot to my family member. So recognizing that you are struggling as a caregiver or you wanting some support as a single-handed caregiver is the first step to healing and to improve your mental health, not just the mental health, but also physical aspects. So, have you ever heard of this ripple effect? So, it means something having an impact on the other person's health. So, a caregiver's mental health is directly affects the persons who they are actually caring for. When you're exhausted or anxious or emotionally drained, it can impact your decisions, the way you handle the patient, and even your ability to give that appropriate care and follow up on appointments, or to give whatever you think you're actually interested to give to the patient. When a caregiver breaks down, the whole system feels it, and the patient's recovery slows down. Family dynamics get strained, interpersonal relationship goes down, and the social and professional work and everything goes down. When all of this gets affected, again the patients and the family members around, and also the social groups gets affected. Here I've seen I've seen literally patients improve after their caregiver started therapy. That's how deep this ripple can go. Actually, the caregiver's health is equal to patient's health. It is just interconnected. Most of the times, we recognize and pick on the family members and start giving advices and suggestions and strategies. But most of the times, people just focusing on the patient, they start pushing patients into therapy and just supporting them, but again without understanding the ripple. So I actually want to say this loud and clear to the in this webinar again. It's okay to ask for help and self care. It's okay to ask for help, and self care is not selfish. In fact, it's your responsibility, I believe, because if you don't care about yourself, you can't care for someone else in the family. Sometimes in therapy, I ask caregivers, what have you done for yourself in this week? You know what? They most of the times will not have answer, and they'll start listing what they did for the patients and the person who is ill in the family, and also the other family members, what they have done and what they are trying to do. And they'll start listing their expectations and their efforts towards them, but they'll miss noticing that they have never listed anything which they did for themselves. Then when we start reminding them, as therapist I start reminding them, then they'll slowly start realizing and ask for, what can I do for myself? I'm doing enough. And I think me doing a lot for the family members is making me feel better, but actually it doesn't. It psychologically makes them feel better. Emotionally, they might start feeling positive emotion that they're actually giving enough to the family members or trying to give enough to the family members. But when they are not giving themselves, or they're not validating and acknowledging their emotions, what they're actually going through, or their thought patterns and behavioral patterns, most often that goes into an unhealthy lifestyle and maladaptive coping patterns. So I wanted to say this, let's normalize this. And when you want a break, asking for a break as a caregiver is not, that doesn't mean you're not understanding, and you're not leaving your family member who is suffering alone. you're actually gaining energy and recharging yourself for the next few weeks or months so that you can do better for them and contribute a lot to their suffering and pain or their illness. So, resting and just trying to set emotional boundaries and seeking help, seeking therapy is not again a weakness. It's just a way to take care or way to take this journey in a positive way. Try to ask yourself regularly, what did you do for yourself in this week? Then that also gives, or when you notice some family members who's actually caregiving, you can also ask the same question to them, just to remind them that they are supposed to take care of their psychological aspects as well. There are a lot of the psychological interventions that actually can help a caregiver who is suffering. So these are all an evidence-based therapies that works. And the first one is psychoeducation. Just psychoeducation helps you understand what you're actually going through with the patient and yourself. It also helps in understanding the patient's condition in deeper and symptoms, causes, external triggers, and internal conflicts within patients. So, and psychoeducation will also help you understand the neurobiology behind and how your neurobiological or your immune system and your body is reacting and responding to the person when you're supporting and caring for them. If you're setting the boundaries and caring for the patients, that's good. If that's going beyond boundaries, then playing that plays a significant role. Cognitive behavior therapy helps challenge those unhelpful thoughts like I must never feel tired or I'm not doing enough. So we often have negative assumptions or questions within ourselves. Say when we are doing a lot to the patients, we might feel low, and that might increase a guilt or that might increase the feelings of sadness within ourselves. And this therapy actually helps in recognizing all of the negative thought patterns within ourselves or negative assumptions within ourselves, and also helps in regulating your emotions. When you actually start understanding your thought patterns, negative thought patterns, then you will be able to recognize your emotional dysregulations caused by the thought negative assumptions, and that might also play a significant role in the way you behave and your functioning in your normal life. So this CBT for caregivers will help in understanding their negative assumptions or negative core beliefs, and then that will also help in giving strategies to deal with all of those maladaptive thought patterns and to regulate your emotions by grounding yourself down, doing simple relaxation exercises. All of that comes in this. Again, mindfulness is a part of relaxation therapy. Here, in mindfulness, we generally focus on the present moment awareness, focus on our body, changes happening within our body, maybe with the five senses, or to focus on what actually you're going through when there isn't emotional change happening because of the negative assumptions. And also the biological changes in your body, biological changes in your body, which can increase your negative emotions. So when you start focusing on all of those, practicing mindfulness will help in increasing your present moment awareness. So psychologists can actually help and guide you in practicing mindfulness on everyday basis. Then there are some support group therapy sessions where you can actually vent out a lot and gain insights about other persons interventions or other persons, the way they care for their family members and care for themselves. So support groups will be another good psychological intervention that might help the caregivers. And narrative and compassion therapy. So when I say narrative and compassion therapy, this can help shift the inner dialogue from blame to understanding. That basically increases an insight and awareness and also the acceptance towards what the person is going through. And that helps, this therapy helps in recognizing their own commitment and the efforts towards the care towards the person who were ill in the family. And this helps in making the person caregiver validate their positives and negatives and their efforts and everything, so that this helps in increasing or positive satisfaction. So I've used all of this with the dozens of clients here in therapy sessions, and they actually work. Not just overnight, but I wanted to say this, it works steadily. Yes, they've worked. And I also wanted to say this, especially to the caregivers. Your body needs care, your mind needs rest, and your soul needs connection. Self care isn't about spa days. Sometimes it's about eating well, sleeping enough, asking for help, setting boundaries, or just going for a walk or going somewhere alone. Just spending your time for yourself. At times, people might feel better, the caregivers or people might feel better taking a 10-minute breathe break or asking for help without guilt to a family member or a friend whom you're so comfortable with. At times, being able to share your opinions assertively, saying no at times, and journaling your thoughts, just maintaining a diary and reflecting on yourself and listening music, trying to find your own outlet is very important. And it's hard to prioritize these things, but when you start when you start noticing or just start practicing in a gradually, you will start looking at the positive outcomes, because you can't pour from an empty cup, right? So just focusing on all of this and filling your cup with positivity and then trying to share it to the family member will actually help in increasing their progress as well. As a mental health professional, I don't just support the patient, I also support caregivers in therapy sessions. Often, therapy becomes only space for the caregivers. Can be at times they might be vulnerable. You know what? I've seen people expressing anger in therapy sessions for no reason. But when I leave them to go with the flow, they'll vent out all of their emotions and they themselves will start recognizing, oh, I didn't know. And in the end of session they'll say that, oh, I didn't know I had a lot of these things piled up within me. I thought it's just all of these situations which I am able to manage and cope with. I'm doing better is what I was thinking for the last 2 3 weeks. But when I see them in the session, they'll feel all of this and they'll say that they've actually had a lot stuffed inside themselves, and that made them feel burnout and that increased their distress. So this realization, when that happens after an hour of discussion, that will actually help in making them understand the need for applying strategies in life and to take care of their own mental health. Here in therapy sessions with the caregivers, I'll listen, I'll validate, I'll educate, and I'll challenge them. So the words is very important. Why I'm saying is, when you start actually listening to people, they will understand and they understand their thought patterns when they went out. And when you validate a caregiver, when you notice a caregiver who's actually suffering or who's actually emotionally unstable, when you start validate their emotions and their experiences, they'll start feeling better and positive, optimistic towards their journey. And teaching them about boundaries will help in managing guilt and burnout. So it's, when I say boundaries, it's not just the social boundaries or not just the way you care for them. So it's not about the time and efforts you put into that process. It's more about setting emotional boundaries, understanding where to stop, understanding about your internal conflicts, and understanding and realizing that where you're supposed to draw an emotional boundary so that you can protect your emotional stability and also you can serve more in a positive way to the patient. So addressing unhealthy thoughts and building resilience is also an important thing. And recognize your weakness. This is one very important thing. People, most of the times, caregivers think that I have that strength and I can push my limit. I can push even more. I can push. So caregivers will have such thoughts. Once, uh, once we start discussing about all of this, they'll slowly come up with their insecurities, their fear too. So that maybe I can list you the fears which I generally hear in the therapy sessions. So they'll be scared to take care of, or they'll be scared about the future, about the negative impacts of the patients, or the based on the negative prognosis of the patients. Once all of this insecurities are discussed, they'll start building up on those insecurities, adding values. So, this is very important for caregivers to recognize their limits and insecurities. So, I just want to share this story. Uh, so, again, no names, of course. A caregiver overwhelmed by Alzheimer's sought help, and she faced anxiety, fatigue, anger, immense guilt, and her journey illustrated the power of dedicated support. Initially, she had difficulties in acknowledging her feelings, and then after over a period of time, after the discussions and guidance, she started setting boundaries, which is again, she didn't change the way she cared for the patient, but she started understanding herself better, and which are all, she started understanding which external triggers impacts her psychological stability. Once she starts setting realistic expectations and limits for herself with respect to the emotional offering what she was giving, she was able to give a lot more than what she was actually intending to do for the patient. Then, over a period of time, with the support, she started creating her own peer groups in her community, and that helped beyond what she was actually thinking, how she was perceiving this caregiver sessions. So, generally, I am here to remind again, this transformation, her transformation was truly profound, but going forward, I if you start recognizing all of this, at least not a community level, but at least to yourself and your family, to a level of your family, you can give a lot. So here at Buddhi Clinic, uh, care is integrated and collaborative. So we believe that care must be integrated, and when all of the multidisciplinary team involves, like neuropsychiatrists playing a significant role in medications, pharmacotherapy, and psychologists supporting mental and emotional well-being, not just for the patient but also for the caregiver and the family members who have doubts and concerns about the patient. And physiotherapist enhances the mobility and physiological functions, and integrated medicine approach from traditional medicine to advanced neuromodulation approach, all of this is not just for the patients, it is for the caregivers too. When we pick up here in Buddhi Clinic, when we pick up on the caregivers distress, and when we start explaining them and psychoeducate about the importance of caregivers therapy, a few of them start stepping into care, few of the caregivers start stepping into therapy, and that have given a significant impact, a significant positive impact on the patient's growth. Once caregivers learn to manage their emotions and learn strategies to deal with the patients. When I say patients, it shouldn't be it is definitely, it is not just the elderly population, but again, it is also a child uh, who have an ADHD or autism or any childhood developmental neurodevelopmental disorders, or maybe adult who is suffering from schizophrenia or any other psychiatric illness. So the caregiver's age ranges from adult to elderly. So all of these caregivers, once they start understand their family members illness, mental health illness, and gain insight with psychological therapy sessions, the caregiver will be able to give a lot to the family members and to the sufferers. Integrated medicine approach, the neuromodulation approach, is again for the caregivers just to maintain their anxiety and depression. So for studies have shown that 40 to 70% of caregiver population have undiagnosed anxiety and depression. These undiagnosed anxiety symptoms and depressive features plays a significant role, and you know what, even after the patient start noticing a good progress in their illness journey, this undiagnosed depression and anxiety plays a significant role, brings in a neurotransmitter changes in the brain and impacts higher functioning more than what actually they think. So to deal with all of that, here at Buddhi Clinic, we integrate all this and give a positive outcomes with the research-based evidences. So significant impact doesn't require grand gestures. It's like just a small check-in, or when you start listening with a non-judgmental ear, helping people with one task or a normal daily activities at home, offering a break. Like when you understand that your family member is caring for the ill patient and ill person in the family, you just trying to help the family member, providing some time for them to rest or focus on their self-care, just to spend 10 minutes to do support a specific chore at home, this all, or give a regular validation to the caregivers. So all of this seems a very small thing, but when you start doing it on a regular basis, you will notice a change in the caregivers' mental health and the way they actually treat the family members. Sometimes the caregiver needs support from their own family, as I mentioned before. Asking them, sharing responsibilities, asking them how are you coping, or how can I help you, just with simple questions or some support, giving them, buying them whatever they need, or giving a, trying to give a hand in when they are doing a specific task, um, providing a support in their career journey when they're taking care of a person. So all of this family involvement plays a significant role, and that is a very important key. So when we care for the caregiver, we care for the whole ecosystem. Health is not just, it's about their own health. If the caregiver is well, the care improves in general at in a holistic way within the family. If we invest in their mental health, we can reduce the family's burnout or improve the patient's outcome, and also improve the interpersonal relationship and build stronger supporting system at home. So all of this is very important for both the caregivers and also for the patient. So I hope this I've given a gist or an outline and understanding about how significant a caregiver's mental health and physiological functions can impact the patient's journey and also the family in general and also the work. So I'd like to conclude this saying, let's start today. I want you to leave with taking all of this as a learning for the day. Just try talking to the caregivers around you. Ask them, how are you doing, or how can I help you. Just giving some a minute in your life to them will make your life be better and their life better. You'll start feeling better once they start acknowledging the way you're caring for them. Advocate for mental health in every care setting, not just with the psychiatric setup, but in every healthcare setting. It's very important to focus on both the patients and the caregivers' physical and mental health. Check in on yourself. It's a gentle reminder again. So, what were you doing for yourself in this last week? Having a checking on this every week plays a significant role again. So let's start changing the story from today. And I want you to remember that if you start a step forward, definitely people around you will notice, and they'll also start reflecting and doing those going forward. So I'd like to conclude here. So if anyone have any doubts, yes. So I can see few of them are here. If you have any doubts, this is open for questions. I can discuss something, or just we can close the session. Thank you for participating.